Hi there, Dr. Nancy Trimbley putting the power and knowledge of your health back in your hands. Today we're going to talk about core and abdominal strengthening. Let me give you a little lesson on abdominal muscles. There are 3 layers. I've heard people say that there's upper and lower. That's not really accurate. There are 3 layers that go deeper to one another. The most external layer is your rectus abdominis. So when you do crunches and sit-ups, you are more than likely working your rectus abdominis. It goes from the lower ribs down to the pubic bone. So you have to move your hips and your rib cage together to strengthen that. The problem with that is if you over strengthen that, you will kind of fix your torso into a flex position, which puts stress on your lower back. That's an extreme, but it can happen. It can also, when you strengthen the rectus abdominis, it makes it bulge out so it can look like you have a belly. We don't want that. The second layer, meaning the more interior layer from the rectus, is the obliques. The obliques wrap from the side and they run obliquely, meaning at an angle, at a diagonal, and they wrap around. So if you do rotational crunches, that's what you're working is the obliques. Good to work on. Very thin muscle, very, very thin, but good to work on those. The reason why I teach the transverse abdominis is this. It forms a brace for your back that is internal. It is the deepest of the abdominal muscles. It actually starts at your spine. At your spine and wrapping transversely, meaning horizontally around your body. It's not a muscle in your back. It's a thick ligament that wraps around your body and then turns into a muscle that runs horizontally across your belly. When you strengthen it, it pulls your belly flat and forms a brace for your lower back. This is a really difficult muscle to isolate. And more than likely, if you're used to doing sets of abdominal exercises, either in a class or on your own, you are blowing past the transverse abdominis. It takes a lot of concentration, and you may only be able to do one of these, 1 rep accurately, and then you'll have to rest. It does take time to build up, but you will see great benefits to your back pain and the flatness of your belly. So this is how you do it. You need to lay on the floor on your back. And you're going to put your legs up in the air. This is essential. Also essential is that you think about pulling your belly button towards your spine. That is how you're going to isolate the muscle. Next is you're going to lift your upper torso up off the floor, thinking, pulling your belly button towards the spine. You'll gently put your hands behind your head and you're going to move 1 inch, 1 inch, 1 inch. Now if you start to feel the rectus activate, meaning you start feeling some pulling here, stop. You have reached your max. You have exhausted the muscle. So you rest, take some deep breaths, try it again. Legs up, belly button to the spine, hands gently behind your head with your torso raised, nose towards the ceiling. 1, 2, 3, and you may need to rest. And just start off with very small sets. But if you do this every other day, you will slowly build up your strength. You'll see your stomach flatten and your back will feel better. So, putting the power and knowledge of your health back in your hands. Bye for now.